The latest on the pandemic, however. Children ages 5 through 11 are already rolling up their sleeves to get the COVID-19 booster shot. The CDC has given the green light to Pfizer yesterday, saying its boosters are safe and will help restore protection as cases rise across the country. Still, roughly 30% of the U.S. population eligible to be vaccinated are still not fully vaccinated. That leaves us vulnerable to these new variants and the swirling pandemic. For more, let's talk to ABC News medical contributor and emergency physician, Dr. Darien Sutton. Good to see you, doctor. So data from Pfizer shows that their booster shot increased antibodies 22-fold against Omicron in 5 to 11-year-olds. Now, explain that. What does that mean? Is it significant?
Yeah, so that is significant. We use these factors to help us understand how effective a vaccine can be. And so the main things we're looking at in these studies include, number one, safety, making sure that there are no safety signals, which luckily there were not in these studies. And the second is immunogenicity, which is that antibody titer level. We look at that and we compare that to older children, adolescents, to try to figure out whether or not they have compatible levels. And we've seen that that is the case here. And the third thing is just seeing if it's effective. Now, that's a little bit more difficult to find out, mainly because children are less likely to get infected with COVID-19 and less likely to be hospitalized, but the risk isn't zero. So it just reminds us of the value of these vaccines. And as you said, only 30% of the children in this age group have been fully vaccinated with their primary vaccine series. So I think that that is the primary focus. And then if needed, the booster would be helpful in protecting children, not only against acute events of COVID-19, but also the long-term possible effects, including multi-system inflammatory syndrome, just to name a few.
And I've got 3 under the age of 11 as well. They're all going to get vaccinated. I'm sure they can hardly wait. But this is good news for those children, for parents like me, for a lot of people. But given what you just talked about, the small number, really, of children of this age who have been vaccinated, how much of an impact can this move have by the government now saying children this age can get vaccinated? Will it help a lot in the pandemic? And what do you tell parents who say, you know, the kids aren't going to get that sick anyway? I just don't like this vaccination idea.
Those are great questions, Terry. And I think to answer that question, we can look recently at our most recent surge, our first experience with the Omicron variant. And studies have shown that children who were vaccinated were less likely to get hospitalized. In fact, unvaccinated children were hospitalized at twice the rate of vaccinated children, which shows us that this vaccine is protective. And to those parents who might say, you know what, there's not going to be a big outcome in my child will probably be safe if they get infected. And the answer to that question is yes, they will likely be okay, but the risk isn't zero. And right now, we've been seeing increasing rates of long-haul COVID-19, which can be associated with cognitive delay, affect educational abilities, also multi-system inflammatory syndrome, and even the risk of myocarditis is higher in natural infections compared to the rare risk associated to vaccines. So with all of that being said, I say to protect your child the best way that you know how, get them vaccinated.
Get those shots in their arms. Well, you know, Dr. Sutton, I've had the pleasure of talking with you now for a while, for months, right, this way. We've never met in person, but it's great to know you, but it has been a while, right? We've been in this pandemic now a couple of years, it feels like. And do you think people are becoming complacent with the virus, right? Even though they're seeing these uptick in cases across the country. I get on the subway, most people aren't wearing masks. You know, people, I think they just figure they're used to it and it won't happen to them.
You know, I see that every day. I have conversations with patients, my friends, and my family, and I understand this pandemic is exhausting. And I think when we're stepping into our new normal, it's not about just going back to the life that we knew before this pandemic, but it's about taking what we've learned and applying that to the future so that we can reduce our risk and the risk of those around us. I think it's really important to understand the history of vaccines and how we've utilized things in the past, historically, prior to COVID-19, and we use them today. And I think that, again, these techniques, these management techniques in terms of preventing our risk are going to be helpful not just against COVID-19, but against other infectious processes, just like monkeypox.
Yeah, that's a great point and a great transition. You know, monkeypox, which is a terrifying name. Those cases have been detected here and in the United States and in Europe. So what is it? Should people be worried?
So monkeypox is a relative of the smallpox virus, and many people may not know about smallpox because it was declared eradicated thanks to vaccines in 1980. Monkeypox is thought of as a less severe, less transmissible relative to the smallpox virus. And we've seen, as you said, a couple of cases here. Luckily, the risk of getting monkeypox is still low and the prevalence is still rare. But the concern is that we're seeing cases around the United States without obvious causes of transmission. And that causes concern because we're trying to figure out exactly how are these people getting infected. Is there a new strain of monkeypox that we're not aware of, or has it become more transmissible in a way that we don't know? Until those questions are answered, will we be able to fully understand. But I think at the end of the day, understanding that the transmission is done via skin-to-skin contact with someone who is infected, and using those basic techniques, washing our hands, keeping masks on, and also being mindful of your own symptoms, if you have any flu-like symptoms or even that typical rash that we see, making sure to call your Department of Health and check in with your local hospital so that you can protect the community around you.
All good advice, both for COVID and for monkeypox, just what we need, a new kind of disease circulating. But Dr. Darien Sutton, we'll count on you to help us through it, no question about it. Thanks very much.
Thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.